Hello everyone, my name is Valentina Catalan, and today I want to show you the factors impacting gestational diabetes mellitus health disparities in the Midwestern United States. In the United States, gestational diabetes mellitus impact up to 10% of pregnancies and can lead to negative health outcomes for mother and infant. Prior research suggests underlying factors including maternal age, BMI, and healthcare contributes to these health disparities. The purpose of this study is to examine the influence of racial identity, maternal age, and BMI on rates of gestational diabetes diagnosis as well as fetal growth. We hypothesized that health disparities in rates of gestational diabetes will not be fully accounted for by the influence of BMI and maternal age. Also, we hypothesized racial differences in fetal growth, birth weight accounting for gestational length, will not be accounted for by the influence of BMI and maternal age. Our methodology was examine 11,311 medical records between 2011 and 2021 from a large Midwestern healthcare system including South Dakota, North Dakota, Minnesota, and Iowa. Our inclusion criteria was maternal age between 18 and 45 years old, first recorded pregnancy, gestational length less than 43 weeks, and recorded pregnancy BMI or height and weight to calculate BMI. From this data set, we limited our analysis to the 9,720 who had BMI and analyzable groups of self-identified race of Indigenous American, Asian, African American, here referred as Black, Native Hawaiian Pacific Islander, and Caucasian white referred as white women. We first analyzable the data discretely summarizing continuous variables with mean and standard deviation and categorical variables using frequencies and percentage. Then we computed odd ratios and 95% confidence intervals for gestational diabetes diagnosis for each racial group using logistic regression in which maternal age, BMI, and sex of the neonate were entered as covariates. We then use linear regression to predict birth weight for each racial group in which maternal age, BMI, gestational diabetes diagnosis, sex of the neonate, and gestational length were entered as covariates. Our result in these models, Black women were less likely, while Asian and Native Hawaiian women were more likely to be diagnosed with gestational diabetes than white women. Furthermore, neonates of Indigenous American women were heavier, while Black women had babies that weighed less than white women. In conclusion, despite having access to prenatal care in the same health system, disparities related to gestational diabetes and fetal growth were observed. These disparities, which are experienced by historically marginalized pregnant women, exist regardless of maternal age and BMI. When we examine the same data set with only racial categories predicting gestational diabetes diagnosis, the model resulted in the same directional pattern for each racial category. Further research is necessary to determine if other factors not available to us in this data set, including experiences of racism, might influence pregnancy health, increasing the risk of gestational diabetes diagnosis and or reduce fetal growth. By providing prenatal care that addresses culturally specific risks for groups experiencing health disparities along with maternal age and BMI, we may be able to improve pregnancy-related health outcomes in the future. This study was funded by NIH. Thank you very much for your attention.